vein that will drain into the long saphenous. So the skin of the prepuce and the skin of the penis are going a lot into the femoral vein. Okay? Then you will see now that there's some fascia surrounding out here. Right? And that fascia, so the superficial fascia is called, the superficial fascia is called the dartus fascia. Then now, look, Crystal, come down here and look. I want you to look and see, sweetheart. Stand up. You see here, there's another white layer. You see the white layer there, love? Mm-hmm. That one is called Buck's fascia. Look how I can hold on to Buck's fascia. So the penis has, a deep fascia that is thick. See that how thick it is? I'm holding it. Mm-hmm. All right? And that's Buck's fascia. Looks like it's about 1 millimeter thick. Okay? Then now, I buck up now the deep dorsal vein, the dorsal artery, and the dorsal nerve of the penis. Deep dorsal vein draining into the prostaticovesical venous plexus, the dorsal artery, and the dorsal nerve. Then there we can see, look, this is all spongy. These are the corpora cavernosa. And look there again, look at there again. So all of this now is covered by another thick fibroelastic membrane, and that is referred to as the tunica albuginea. Okay, it's thick. And you see now right here, there's what's called the membrana, the pectiniformis, membrana pectiniformis, right? Then there we can see the corpus spongiosum, and that is the what? That is the urethra. The urethra. See the urethra right here? I don't know, I can't see, because I know I can't look behind me, I don't know eyes behind my head.
Just point it.
So I have to depend on my...
It's right here. So you have to do it from the side, and then go from the front.
So here, see I'm here? Okay, so there. And I thank my IT lady, that's very kind, you know? Right. So there you can, but I want you to see Buck's fascia. See Buck's fascia? Mm-hmm. You see it, yes or no?
Yes.
Yes, see how thick it is? Right, and then you can see the tunica albuginea. Okay, now, there we can see now, so what I want you to see now is the root of the penis. All right? So, Crystal. Oh, sorry, Crystal, you can take that up for me now. Yeah. Crystal, see if you can come stand here. Just right here. Just right here. Put your feet right here, sweetheart. I don't think you'll block it. I'm going to hold this now. You hold it. Hold it. Is it the screen, yes or no? On the screen, yes or no?
Yes.
Good. What do you think you're holding there? What do you think you're holding there? That's the urogenital diaphragm. What are you holding there? The urogenital diaphragm. All of that is filled with muscle. You can go back to your seat. All right? Then you see the pudendal nerves and vessels. See them right here? Dissected out of Alcock's canal. And Crystal, push the forceps right in here now. Wait, I'll show you how to do it. Give a chance. Wait. There, you bugger. Take the forceps and push it right through that hole into there. Yeah, right into there. Go right in. Good. You see how you're going? You have now gone into the deep perineal pouch. Come back out. Push it back in again. Follow the nerve. See the nerve here? See the nerve here? Just follow it in. Boom. See you're in the deep perineal pouch. And you can see that there's some arteries, right? This nerve is the dorsal nerve of the penis. That one, see the dorsal nerve of the penis? Right? So all the sexual pleasure that the male is feeling in there, this is the nerve that is conveying it, this nerve. Right? Then now, that is the nerve now, there's a big nerve going inside, and that is the perineal branch of the pudendal. That has to go now to muscle. Right? This is going to muscle. This is the what? The urogenital diaphragm. Then we will see now, that's the crura of the penis. See right here? I've just dissected off a part of the crura of the penis. And it's surrounded by ischiocavernosus. This is the bulb of the penis right here, and that muscle is bulbus spongiosus. So when we look at the penis here, we can see now that this is the corpus spongiosum. See right here? Take them off like that. See right there? And these here, that's the corpora cavernosa. And there you can see the nerves and vessels going along, right? That's the corona glandis. This is the external urethral meatus. So remember how the instrument is passed. The instrument is passed down this way, okay? Not up. See, when I go up, I'm in the navicular fossa. So whenever you're going to be at the hospital, love, and you're going to be catheterized in and all of that, okay? So you're passing it down when you're going down, right? Now, there it is, and we can open up now the corpora. I want you to look carefully and look down in there. When we open up the penile urethra and you look in there, you see a lot of little holes. See there? There are a lot of little holes in there. See there when you open up in there? And a lot of those little holes are the glands of Later. So you pronounce it, Patrick? Later's glands? These are the ones that become infected in gonorrhea and all of these kind of things. Reasonable? Right. Now, by the way, I remember that there was a beautiful student that we had, you know. Pretty lovely girl. She became my good friend, you know. And do you know a guy gave her an SD, what do you call it? SDT?
STD.
Is what they call it? STD. It ruined her life. She ended up now with, we had a professor of microbiology, was a very nice lady, Professor Dorothy King. She was the wife of Professor Hugh Winter. And that girl was a pretty lovely girl, you know. But my friend, the kind of infection that she got from the guy was a terrible story. And they tried all kind of things with the poor young lady. Reasonable? And it really ruined her life. She was my good friend. Up to today we were friends. Eventually so. But all I can tell you is that there are some kind of infections that the antibiotics can't even deal with. You know what I mean? Right. So they have to be very careful. Yeah, very careful with the partner. Okay. So there you can see when we get back down into here, look how large it becomes. That's the intravalvular fossa. See the intravalvular fossa right down there? Well, you have to go, I can't do anything. That's the intravalvular fossa. No. There we can see Dr. Ledenko's favorite, the prostate. Now when we watch those dimensions there, you can see this prostate is a bit hypertrophic from the dimensions I gave you. Definitely this is not 2 centimeters, this is much larger, okay, but not a great. But there is the prostaticovesical groove for the inferior vesical artery, and there now, that's the posterior aspect of the prostate. So these are referred to in the old days as the pearly gates of the prostate. So this cave of Retzius would be here, and then there we can see the retroprostatic fascia. So there'll be retroprostatic fascia. This is the rectum right here. So DRE. So Crystal would have to do a DRE on our patient, and you see that you have to put the finger all the way up. See, you have to go right up. And when I put my finger right up, and my finger might be longer than yours, see where I am? I'm right up here now. So right in. And see now I'm going to go like that, right? And there you can see now this is prerectal fascia, retroprostatic fascia. And normally should be mobile, okay? Then we see the seminal vesicles. See how big they are? The seminal fluid. Now, you know, when a man ejaculates, it's a very forceful ejaculation. Reasonable? Interesting, even when I dissected into the seminal vesicle, you know, I'm lucky I was moved over aside. This is of a cadaver still, you know. What the hell, man? The man is dead and he's still what? Man is dead and gone and the ejaculate is very there. It's under pressure. Okay, so look at the honeycomb of the center. So the bulk of the man's ejaculate will be what? From the seminal vesicle. You'll have some prostatic secretion, okay, and then you will have the semen coming along, right? And there you can see the vas there, okay. So that's good, okay. All right, away with this, let's put him somewhere. Mr. Where we would put him?
Not understood.
Let us look at the female. Right. Excellent. 300 marks. Okay, so there we are with the female now. Okay, very good. All right, let's relax till we come down. Right? These two guys are called, or girls are called the what? That's the labia majora. See the labia majora right there? So back here where it meets is called the posterior commissure. Where it meets at the front now is called the anterior commissure. Reasonable? When we get in there, we will see now the labia. So this is the pudendal cleft. Reasonable? And then now we will see now, you can see there, Crystal, and you there now zoom in hard, and there you can see her labia minora. Okay? So women are very concerned about their nowadays, or the appearance of the labia minora, and they're doing all sort of labioplasty and all kind of crazy stories. Okay? Right? But what God gave you, just relax. Right? So everything is beautiful. You don't have to this, that, and the other. So there, that is the labia minora. So there now we're in the what? The vestibule of the vagina. So then we open up. We're opening up the vestibule of the vagina, right? And then, Crystal, look how large they are, sweetheart. So this now is where the labia minora is meeting back here. So right here, that's the fourchette. See the fourchette right here? And it looks like a fork. See, like a little fork? That's the fourchette. This back here is the posterior commissure, and right at the posterior commissure back here, that's where the perineal body will be. This area is called the navicular fossa. What is it called? Navicular fossa. And that area there, that is the area of the labia minora. So all of it here now, so watch here, Crystal. Boom. Crystal, take that forceps and my dear, who is it with the camera, you need to really help me here on this. So it's very important for them to understand. Take this forceps out. But look where you're taking it out from, you know. Yeah, take it out. Push it back in. And go ahead, go right in. Let me see if you come here at the right angle. Give a chance. Good. Go, come out. Go in. It's still not Crystal. Come, Crystal. Come, man. Come. No, Crystal, it's not force, you know. It's not force. You have to be guided. No, sweetheart. Don't use force. Technique, sweetheart. Right? What you have to have in life? Technique. Very good. All right, out again with it. All right, in again now. Good, you got it. You got it. Take out again. I have a reason why. Back in again.
Good job.
He's whining.
You feel it going in. Good. What do you think you have entered?
Deeper, large.
Is it one of I'm not sure. Like a parking
like a
or
gland?
something?
Would you say that it's large? That space is large? Just yes or no? Yes. It's large. Come out again. It's big. Look, sweetheart. Go in again. No, you have to look. So you've entered Bartholin's ducts. Right. Which is right at the level of the introitus. So just outside, this woman has had children, so there's no hymen there or nothing again, reasonable, the remnants are all gone. And there, so what you have to see is that those ducts are very large. So very easy for the female to get infected in that area, to get a Bartholinitis, okay? Right? So the Bartholinitis is quite easy for the female to get, okay? And then they're going to make a little an incision right here. And Dr. Ledenko will tell you that the ONG person has to be very good, and sometimes the female gets a recurring Bartholinitis, right? And then he has to do what is called a marsupialization, right? So very young females, they get, once they become sexually active, right? Sometimes they end up with that, right? So there now, we're now opened up, and there we're into the vagina. See the vagina? Close up everything. That's her urinary bladder. You see the urinary bladder? See the detrusor muscle of the urinary bladder? Yes or no? And there is the vagina. See, that's the posterior wall of the vagina. Now, that posterior wall of the vagina has right, what you think, right behind it, the rectum. See the rectum right here? Okay, so right here. So, in fact, in her, she's developing a bit of what's called a rectocele. Okay? So the rectum is kind of wanting to shove inside. Reasonable? So in that vagina now, which is closed, it has like a H shape, right, Patrick? H shape. Reasonable? So there is the H shape. And then all around here now, that vaulted area around here, these are what are referred to as the fornices. Anterior, lateral, and posterior fornix. Okay? Now, and there you can see this is the anterior wall of the vagina, and you can see now that the base of the urinary bladder, see the base of the urinary bladder is in relation to the anterior wall. So she may end up with a cystocele, right? So she can get a cystocele, a rectocele. The intestine may want to push down through the fornix of the vagina, and we may get an enterocele, right? And then now the cervix of the uterus may want to come down in there, right? And we may get the prolapse. That condition has a condition, Patrick, with it. You call it rectocele, cystocele, enterocele.
Yeah,
with the cervix.
Everything.
There's a terminology. Some one of these students after the lecture came up and knew the term, you know, with the cervix coming down. There's a specific term like cystocele, rectocele, I can't remember. No, anyway, forget it. That's it. But anyway, so there you can see that's some female, okay? All right, just relax. Okay? We're getting there, you know. We are what? Getting there. All right, in 5 minutes, I'm finished. Okay, so let us look here now. Okay, let's look at this lady here. Okay, so there we can see the posterior wall of the vagina. You see it, yes or no?
Yes.
This is her rectum right here. See the rectum right here? This area is rectal ampulla. Columns of Morgagni. Okay? Not a Bertini. Morgagni. What I want you to see is how thin the rectal wall is. Okay? And there you can see it applied now to the posterior wall of the vagina. See the vagina right here? Yes or no?
Yes.
And see now when we trace up here, so this is the area of the introitus, yes? And that's the posterior wall of the vagina. And this is the what? The posterior fornix. Okay? Now, this is sort of paramedian, so the cervix has been kind of there. So, the males have to be very careful with the females, you know. So this kind of rough sex, and when the man is too far and down, and he's bam, bam, bam with the cervix, it's not a good story at all. So remember, the man is the art of lovemaking, you know. Right? It's not, you understand, sir? The art, it's an art. Then you can't go damage the poor female. Reasonable? So many of the males know they damage the poor female, right? So there you can see the cervix right here, and there you can see how the peritoneum comes down, and that's the posterior fornix of the vagina. So this is where they commonly are going to do coldocentesis. So you see it all the time, a ruptured ectopic pregnancy. My daughter has a lot of scanning, and the females have a lot of what? Ectopic things, rupture. Then blood goes down, and blood is very irritant. And blood gets down into the pouch of Douglas. There's always a little fluid there. But blood gets down there, then they have to do what they call the centesis. But they go through the posterior fornix of the vagina for 301 other things, right? So sometimes they want to retrieve an egg from the female. They do all kind of procedures, okay? And remember, the best way to examine the ovary, so the women always have to be examining the ovary, right? They must be examining the ovary, right? So the females, the ladies, like parents, your mom, dad, always you have to keep an eye on the ovaries. Because when they get ovarian cancer, it's too late. Once the ovarian cancer presents with ascites, it's too late. So they do what is called right there they do what's called a transvag, right? So they have a very small probe, and they put a condom over the probe, and they go right up, and then they scan. And when they're scanning like that, the ovaries just fill up the entire screen like that. So just like that screen, this is looking at the big ovaries and examining it. But the females have to, because of all the different cell types. But there you can see the bladder, how it's related to it. Okay. Last specimen now, here. Okay, yes. There. So there we see now the female. All right, so there are a lot of things to look at in here. So just relax, 5 minutes and we're finished. How many minutes? 5. No more than 5. You can time it. Okay? So we're down, look right down here, sweetheart, right here. You can come down here. Can you see what I'm showing you? So there you can see, let's just pick up some structure. Just for fun, this is the psoas minor. There is the femoral nerve, right? Femoral nerve. This is the external iliac artery, vein. You come down here, just relax. Just relax, give a chance. Give a chance, I'm trying to pick up some structures here. Wait a while, wait, give me a minute. Bugger. Round ligament of the uterus. See the round ligament of the uterus?
No.
Well, then you have to kind of position the camera for me a little. Sweetheart, you can position the camera low. And 5 minutes and I'm through. Right? There you can see it on the screen.
Can you turn it towards the camera?
Yeah. You have to help me now. We have to be very dynamic now. Right? So that's the round ligament. You see it on the screen, yes or no?
Yeah.
Yes or no?
No.
No.
Can you turn it towards this side? Right.
No, man, then they won't say anything. Yeah.
Yeah, see, it's right.
Yeah, zoom in on here now. Just relax. I know I've kept her for a long time, It's past her lunchtime. What's the time?
12:27.
Wow. So that's the round ligament of the uterus right here. That's the inferior epigastric vessels. Then now, you're seeing here now, that's the femoral what? Ring. Just relax. There, this ligament that's coming down, that is the medial umbilical. Yes, see the over there? That's the medial umbilical. Okay? That's the fibro umbilical artery. Okay? Now, look at it now, the external genitalia here now. Can you see? Yes or no? You pick the, have you seen this? Yes or no?
Yes.
All right. Yes or no?
Yes.
Okay. So there we are. So there, you're looking
You
out
want
the
to go
glans clitoris.
Where?
You see the glans clitoris? Yes or no?
Yeah.
So that's the labia minora. Okay, that's the labia minora right here. Okay, and there we can see the glans clitoris, and there we can see the shaft of the clitoris, and it's quite long. See the shaft of the clitoris here, and then descending on the shaft of the clitoris here. These now are the dorsal nerves of the clitoris. There are a lot of them there. There's a dorsal vein of the clitoris, and then all of these boys coming down here. So this is the crura of the clitoris. See the crura right here?
Yeah.
This thing is long. It will go way down, right? if you see, so the clitoris engorges maybe about 3 times the size when it is sexually aroused. So the clitoris now serves only one function, and that is for sexual pleasure of the female, right? Nothing else, okay? Right. So there you see now, that's the clitoris that is attached now, the crura, and then you can see now the crura now bends to become the what? The shaft, right? Remember, this is an elderly female, right? So a lot of these things are atrophic. There we can see the glands, yeah? And that's now the, so right here now, this is the what? That's the hood of the clitoris. So the clitoris is covered by a hood, okay? Now the clitoris can vary a lot in size, okay? Even that now can vary a lot in size, okay? And in some females, it's like a small penis, okay? She looks very perturbed. Correct, right? But don't worry about that, sweetheart. So there you can see it, and it matters what on the level of the androgens in the female, right? So some females, you see, are very masculinized. So the more androgens and the more receptors, the more the clitoris is enlarged. But definitely we see the nerves here, right? Then we see the labia majora right here, okay? Now, if you take down here, okay, and I come down here, look down into here. You see down here?
Yeah.
So there you can see the crura, the clitoris. You see it on the screen, yes or no? You see it, yes or no?
Yes, actually.
See, look how big it is, right? And it's covered by skeletal muscle. Watch the forceps, and look how far I'm going down. So there, so let me come here. So that's the length of the crura, the clitoris, of the crura. You see how long it is? Boom, I've gone right down, right? And it's coming up to the shaft. So it's quite a large structure, okay? But you don't see what? Most of the clitoris. You only see the little tip of the iceberg. And all of that is erectile tissue. No. You can see, I can show you where the round ligament is going into the skin of the labia majora, right? And you see that going down to the labia majora, you see all of these guys that are coming down here. Look, Crystal, come and look over my shoulder, sweetheart. Look over here. All of these are nerves. So this is just like Dunn's River Falls. Okay, so the female external genitalia is very, 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 very what? Well endowed with. She still looks very perturbed. Right? She's very concerned. Look here, Patrick. I don't know why she's looking so very concerned and upset about the whole thing. But there you can see that it's like Dunn's River Falls. Okay? So the nerves that are coming over. So there are a lot of nerves. So we have the posterior labial nerves coming around. And then we have branches of the genital, branch of the genitofemoral, and then coming out we'll have the ilioinguinal nerve, right?
Yes.
So it has a very rich innervation. All right. So, and there you can see the bladder. All right. End of what? And there you can see end of story. Okay. So and there we're going up into that's going up into the introitus. Okay. Right. But you can see. Vroom, vroom. And there, by the way, even more, watch here now, that's the bulb of the vestibule. See the bulb of the vestibule right here? It's all erectile. See, it's all erectile tissue like a sponge. So when the female becomes sexually aroused, all of that area may about 3 times become engorged with blood. Okay?
Could you show that
All right.
again?
So
Please?
there, that's the bulb of the vestibule, and that's the crura. And this is a suspensory ligament of the clitoris right here.
Not seeing, sir.
Right. All right. End of story.
Would it be possible to find